Good afternoon. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Today is Monday, May 11th. My guest today is Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department. As of today, the Governor's New York on Pause order is set to expire this Friday, May 15th. I've been in several regional and statewide meetings over the past few weeks, and I will continue to update you as we go through the process. Here's what we know today based on the Governor's statements. CDC guidelines. Based on CDC recommendations, once a region experiences a 14-day decline in the hospitalization rate, they may begin a phased reopening. As I said last week, we are part of the Central New York region, and I have been in meetings with my colleagues in Onondaga, Cayuga, Cortland, and Madison counties to plan the steps we need to take for reopening. Industries. Business in each region will reopen in phases. Phase 1 will include opening construction and manufacturing functions with low risk. Phase 2 will open certain industries based on priority and risk level. Businesses considered more essential, with inherent low risk of infection in the workplace and the customers will be prioritized, followed by other businesses considered less essential or those that present a higher risk of infection spread. Regions must not open attractions or businesses that would draw a large number of visitors from outside the local area. Business precautions. Each business and industry must have a plan to protect employees and consumers, make the physical workspace safer, and implement processes that will lower risk of infection in the business. The state will be announcing sources of information on this soon. Building healthcare capacity. To maintain the phased reopening plan, each region must have at least 30% of hospital beds and ICU beds available after elective surgeries resume. The testing regimen. Regions must implement a testing regimen that prioritizes symptomatic persons and individuals who come in contact with a known COVID positive person and conduct frequent tests of frontline and essential workers. We are working on these details. Regions must maintain an appropriate number of testing sites to accommodate its population. The region must also use the collected data to track and trace the spread of the virus. Tracing system. There must be at least 30 contact tracers for every 100,000 people. The region must also monitor the regional infection rate through the reopening plan. Isolation facilities. Regions must present plans to have rooms available for people who test positive for COVID-19 and who cannot self-isolate. Regional control rooms. Each region must appoint an oversight institution as its control room to monitor regional indicators during the phased reopening, including hospital capacity, rate of infection, PPE burn rate, and businesses. Protect and respect essential workers. Regions must continue to ensure protections are in place for essential workers. Governor Cuomo announced earlier today that New York will be reopening drive-in movie theaters and some other low-risk businesses and recreational activities statewide on May 15th. In addition to drive-in theaters, outdoor activities like tennis, as well as landscaping and gardening businesses, will be allowed to reopen. In order for business to reopen, each business and industry must have a plan to protect employees and consumers, make the physical workspace safer, and implement processes that lower risk of infection in the business. These plans must address the following items. Adjust workplace hours and shift design as necessary to reduce density in the workplace. Enact social distancing protocols. Restrict non-essential travel for employees. Require all employees and customers to wear face masks if in frequent contact with others. Implement strict cleaning and sanitation standards. Enact a continuous health screening process for individuals to enter the workplace. Continue tracing, tracking, and reporting of cases, and to develop a liability process. We hope to have more guidance and information on this process in the next few weeks. At this point, there are still a lot of unknowns, but things are changing daily. Coronavirus is still active in our county and in our region. We each have to do everything we can to prevent this virus from spreading if we hope to reopen our region soon. Now I will ask Diane to give today's report from the County Health Department.
Thank you, Mr. Chairman. As of today, we've had 2,149 residents tested or scheduled today to be tested. We have 73 positive test results that have been returned. We have 60 residents that have recovered from COVID-19. We have 3 deaths reported due to COVID-19. We have 10 active cases of COVID-19. 2,003 negative test results have been returned, and we're still waiting for 67 test results to be returned. We have 53 residents in precautionary quarantine and 56 residents in mandatory isolation or quarantine. To date, 2,239 residents have completed or been released from isolation or quarantine. Thanks.
Thank you, Diane. The County Health Department is the lead agency in arranging for testing for those who have symptoms of COVID-19. If you think you have symptoms, or if you have questions, please call the Health Department's hotline at 315-349-3330. Visit the Health Department's COVID-19 webpage at health.oswegocounty.com/COVID-19 for the latest updates and credible sources of information. Stay safe and healthy, and thank you for your patience and cooperation. It is making a difference, and we're getting through this together.